Hi, and welcome to the Care Transformation Studio Pitch to Partner series, implementing new technologies inside the four walls of healthcare. I'm your host, Amber Fencl, an advisor here with the Care Transformation Studio. With me, we have Jomo Starke. Jomo is an expert advisor for citizen health strategies and a frequent collaborator with the Care Transformation Studio. Jomo, it is so exciting to have you with us. Thank you so much for being here. Would you mind just sharing with the audience a little bit about yourself and your background?
Sure. Thank you, Amber. Really excited to be here. Really excited to have this conversation. A very timely conversation, right? Jomo Kenneth Starke, about 30 years in this health data game. Actually started in the med device industry. Have spent time at med devices, spent time working for provider orgs, doing provider enablement, working directly with physicians and physician offices. Spent time working for a Medicaid organization. Ran a lab there that was testing new technologies for physicians and particularly in the Medicaid space. And then for the last 15 years or so, I've been in and around the health information exchange industry, such as it is. And I worked with Manifest Medics here in California. And in the last few years, I've worked for several large public and private exchanges, but really lots around health data, clinical innovation, and all the fun stuff that goes therein.
Fantastic. Thank you for sharing that. And for all of us, just to have a grounding in the context of what we are here to talk about, I'm going to share a little bit of background and then we will get started. So we're going to spend the next several minutes talking about how do we introduce new technology into today's climate that is both complex and it's difficult for the healthcare industry. Along with economic constraints, we have providers that must balance regulatory concerns, pressures, cyber threats, quality, safety, burnout, finding the right talent, enough talent, and all while also trying to justify bringing in new innovation into the clinical workflow and the health system by and large. So we're going to talk about what is it like to try to bring technology into the four walls. Jomo's going to share some of his experience and his insights. We're going to explore what are some of the things that work and don't work. What are some of the pitfalls that technology companies may encounter as they are pitching and working to become a strategic partner to healthcare systems? What does a timeline look like? And really closing the loop on, what are some nuggets of advice that we could offer our audience as they embark on bringing innovative technology into the healthcare ecosystem, particularly in the provider space. All right, so let's jump in. My first question for you, what have you found is required to create a successful environment, essentially, for clinical innovation? Share what those environmental factors may be, market trends, culture, stakeholders, C-suite dynamics. What do you feel is required to create a truly successful environment for clinical innovation?
Honestly, this is a really tough environment for clinical innovation, specifically with regards to investment in digital health technology and the related clinical data infrastructure, which is kind of my world. A little background, we're in a perfect storm of sorts, and I've seen different folks talk about pieces of this, and I've really been formulating this in real time. But so if you go back to 2020, when the pandemic hit, health systems saw the reduced census as an opportunity to invest in digital health projects, maybe ones that they were too busy for, and now they've got some time. And so there was an influx of enterprise spending, and then there was also an influx of investor spending in the technologies that were flowing into these gaps. And the sky was the limit, right? It was a really fat time in technology, and salaries went through the roof, and I would categorize as irrational exuberance on the part of both the health systems and on the investors. But many of the promises of ROI never materialized, and you touched on it, right? This is a huge piece of all of this, I think, is our challenges around measuring and demonstrating ROI, right? And the promises of ROI never materialized, or maybe they never were effectively planned with the stakeholders in the first place, right? There are a lot of lessons here about, I would argue that much of the health system spend that happened was done at the behest of the C-suite, who were going out and deciding, hey, strategically, this is a good time to roll out X, Y, and Z. Let's do it. And so they go out and they get excited about a tech and they buy it. And the stakeholders themselves, the business people, oftentimes were left out, right? And so I think it wasn't the normal vetting process that might take place. I think there was a kind of a rush to market, right? And so this is classic over promising and under delivering, right? So fast forward to, last year, right? And I think that what we're talking about now really has really been going on for about 18 months, right? Yeah. At least. So now you've got the health systems pulling back. Folks I'm talking to, working with, have 2 or 3 failed projects. They've made investments in things. They bought something just because it was cool, and it hasn't panned out. And so you've got health systems pulling back on their spend, and then you've got the investors pulling back on their spend as well, right? So you've got private equity pulling back and venture pulling back, and so this, really this, kind of a perfect storm brewing of market and conditions and technology. And then the health systems themselves are dealing with issues with margins and with shifting reimbursements, right? So they're actually laying off some of the very staff that were rolling out these technologies and managing these processes, right? So you've got staff of analysts and pop health folks and, digital health enablement people that were working in the health systems that rolling this stuff out going too, right? This is a bunch of big challenges in the digital health space, and particularly for startups, right? If you're a startup coming into this, it's a challenging time to be trying to facilitate either if you're a startup and you've got a new tech and you're trying to bring that to market. It's also a challenging time if you're in the health system, if you're an innovator, if you're running all my friends with innovation in their title who are trying to deploy, new clinical projects. It's a tough time for them too. The capital is dried up on both sides, right? But yeah, I think and we'll talk about this more. I think the answer is ROI, right? There must be a fixation on ROI by both the vendors and by the systems.
So alignment to calculate ROI, capture ROI, and report against ROI for new innovation is what I'm hearing in a very short, abbreviated synopsis of what I think I just heard you say. So there's a question mark at the end of there for validation. Did I pick up?
Absolutely. I would add to that again. Yeah, great high level, but I would add to that, engagement with stakeholders early and often in terms of what exactly it is they need, right? And how you're going to measure it, right? So yeah, it's important and underappreciated, I think, in the vendor community.
Very fair. And to underscore the stakeholder piece, in my time of digital health implementations and really pre-implementation, so in the scouting and the vetting phase, and sitting on the receiving end of a lot of pitches from some really great companies and some smart folks, it was often missed to have the right stakeholders advising them before they are even in front of us from a provider standpoint. So think of me representing the provider. They often overlooked really understanding who would be the boots on the ground and the roles represented in the workflow of their product or their service, and not fully appreciating and understanding what that group of individuals would require to be successful or even want to do this or to build that buy-in. And so if you are meeting with a prospective client or a provider that you want to become a partner to, I implore you to question them and ask who are those representatives inside of the system that should be around the table with you from the very beginning to build that understanding and that buy-in and to pressure test. The last thing you want to do is to think you've got a great deal going and you get really far down the runway and you're building proposals and you're starting to arm wrestle on terms and negotiations, and then a new person is interjected from the provider side that says, hey, time out, we can't use this because of these three very good reasons, and the wind is let out of your sails. You don't want to get that far down the path. You want to have those folks early on. So I can't agree with you enough on stakeholder engagement and the right stakeholders very early on in the process. So
yeah, I would say I would basically add to that, and I would say make sure those stakeholders, some of those stakeholders you alluded to it, are clinicians, are the actual clinicians that are whose jobs are going to be impacted, who are on the ground doing the work. They need to be exactly as you say. Again, when you talk about stakeholders in a corporate environment, you're talking about the business unit, right? And then you're talking about the directors and the managers and the folks actually doing the work inside of one of those units. The clinician engagement itself is another layer, and it's not part of their normal routine unless they've been proactive and very prescriptive about pulling these folks in.
That's right.
And you have to want the things they're going to tell you, right? They're not going to tell you easy things, right? And I was involved in a very large project with an org that, $4 million into the spend, they finally got some feedback from some key physicians, and the thing was basically dead on arrival because they had done exactly what we're describing here, and they hadn't talked to the right people.
Yeah.
And this is not that weird of a thing. Like I hear anecdotal stories about stuff like this all the time.
Yeah.
Right. And again, and I'll harp a little bit more on the clinician side. If you're a technology company and you're selling to healthcare and you don't have clinicians on staff or advising you, you're not a healthcare company.
Correct.
Right.
And you'll lose all credibility as soon as you get in front of that provider if you don't have your clinical counterparts and your clinical advisors at the table with you.
They must be there with you, or you're just another one of these people building cool things.
Exactly.
Right.
Bright and shiny. Yep. Okay. Next question. Oh, I like this one. If you could tell the vendor, the partner, the company, the third party, one thing to do differently in that courtship stage when you're pitching, when you're prospecting, when you're building the relationship, what would that one thing be? And what are the common mistakes that you're seeing these companies make that are avoidable? What are the mistakes to avoid?
Fabulous question. I like this one too. I mentioned ROI, and I'm going to keep harping on it. Right, that's the answer to there's a few answers to this question, but it's the one thing. There is an underappreciation, as I mentioned, of the importance of measurable ROI in the health tech vendor community itself. Many very smart technologists I know and have worked with are still subscribed to this kind of build it and they will come mentality. You said shiny things, and there's nothing wrong with building cool stuff just for the sake of building cool stuff, right? But if you're trying to sell or implement a digital health technology to support a clinical innovation effort, the vendor must be ready, willing, and able to map whatever it is they're proposing to measurable improvements. And then be ready to live up to those promises and probably contractually live up to those promises, right? And talking about C-suite involvement here, they can be the good guys or the bad guys, but you have to have them involved here early. It can't be just the C-suite. It can't just be the business, right? Because all these projects are going to be fighting for a reduced capital pool, like we've been talking about. There's less investment. There's more reticence to invest, and they're going to require you demonstrate ROIs of at least 5-to-1, if not 7-to-1 or 9-to-1. Contractually,
and in a 12-month span of time. So the days of a 3-year forecast and having the patience for that return to come in 3 years, I believe, are gone. The break even in 12 months, the return in 18. These are shorter time periods that your operational finance partners are looking for. to really find that justification.
Absolutely. Absolutely. Um, that was a long-winded run up to your question. Successful vendors are going to build this ROI mentality into their core business model, right? And they really need to enable their customers to start small and grow with the project as it demonstrates success, right? So this is kind of leads me to my next point. Again, this is something that vendors don't like, but it's a necessary way to move forward. Vendors must be ready to start their engagement with a pilot or a proof of concept. I hear this from everyone, right? And vendors they don't like those words, right? They don't want to start small. They want to start big. They don't want to put all of their revenue in the success bucket because that's a risk, right? But it's the risk that here to now has been borne by the health systems and the buyers, right? And so they, having been burned a few times, are pushing this back out on the vendors, and vendors don't like it. Right? They don't want to do it. They don't think it's their job. They think it's the health system's job to prove ROI, not theirs, right? And I would say basically, the days of the 6 and 7 figure deals are largely, unless you're Epic, right, are largely in the past. And so most of these health tech vendors are going to have to start small. They're going to have to come up with a way. And again, they need to do this work before they go to market. This is part of their go-to-market planning, is figuring out where they're going to plug in, what it is they're fixing, how they're going to measure it, what a good outcome looks like, and they need to sell that as part of the run-up to the project itself. That's a very different way of selling for much of the vendor community, right?
I would also offer, in addition to that, and kind of in conjunction, building use cases and validated outcomes with previous clients, partners. You may have to do some negotiations on what terms look like in order to get some of this early data captured and documented and validated with perhaps an early adopter of your solution. But the more that you can get the published studies and reports that document outcomes that can be referenced for that tangible ROI, the greater success you have is in getting the attention and proving and building that credibility of what you're proposing your solution can do. And I would also add in, try to have as much of a variation in those use cases and studies that you possibly can, because one health system does not equal all. So a health system that is a community system with three hospitals and 800 providers looks very different than an integrated system that's spanning multiple states, that has a large value-based contract set of lives that they're representing. Perhaps they've got a highly diverse demographic of patients based on their own markets, and they'll have sub-markets inside if they're spanning multiple states. Systems that are sitting on the East Coast are going to look different than systems that are sitting on the West Coast or in California and Washington. So there's a lot of variety that plays into the actual crunching of the numbers when you begin to look at that business case and building that the justification and truly understanding the cost and those returns.
Great point.
So the more that you can have a diverse set of examples and proven data that can be referenced upon, the more success you're going to have as you go out and cast your nets and talk to different systems. And you may need to target your prospect list according to the systems that look like your early successes, right? To try and gain some of that momentum. But it's really important that we all understand that not one health system looks like the next. Ask a lot of questions, try to get as much detail about their demographics and their contracts and the types of problems that they're looking to solve inside of that system, and how large are they. how many EMRs are you facing? What are the other clinical apps that are in-house? What are the other things that they're doing to solve for the same problem? That will be great intel for you and for your partner that you're looking to build this relationship with to really create a robust story and a robust pro forma. Ready for the next one?
Do it.
All right. So you've got a lot of years of experience in this space. When you think back and you reflect, could you help our audience understand what does the process look like when proposing to partner with a system, with a provider? And let's go with, let's think about, for the sake of this conversation, a mid to large size integrated health system. What does that timeline look like? What is the scouting? What is that selection process like? What does procurement and contracting, what is that whole experience? Because some would think it's very succinct and a short runway. Those of us, I think we can, you and I can agree, and we'll share some of our intel, but it's not the short runway that you might want it to be. It's a much longer runway, longer than any of us, no matter what side of the table you're sitting on, wants it to be. How does our audience think about the process to get to a place of inking a contract? And how far in advance do you see the systems really starting this process? What's been your experience in this space?
It can be years, right? I mean, if you're talking about a substantial build out of a function, it can be, I'll look at analytics for a bit because I know this is an area I've spent some time in. I mean, there are more than 50 viable health analytics vendors out there, right? And if you dive into any subsegment, there's, can be a dozen. Trying to just learn the difference between these. I mean, even taking a step back before that, like everybody thinks they need analytics, right? Everybody or knows they need analytics, right? They need to measure the business and measure the projects and measure their outcomes and measure their effectiveness and their HEDIS scores. And I mean, all these things are metrics based, right? And I need a dashboard to look at it because I don't want to be printing out reports and handing them to execs, right? So there's the traditional process is very drawn out and challenging, but I'm gonna look through an Epic lens a little bit here because you talk mid to large size health system, they are by and large Epic, and they are moving quickly toward all being on Epic, right? So let's talk about this through an Epic lens, right? And I actually heard was listening to an Epic CIO being interviewed on a blog advising digital health startups how to sell into the Epic world. So what he described was business stakeholders would approach him with a problem or a request. One that I ran into personally was care pathways, right? Okay. He would then go to Epic and find out if they offered that functionality or if it was on their roadmap or if it was, where it was in the Epic schema. And then based on that answer, he began an internal process to identify and engage a third-party vendor that might help solve that problem, right? And Epic doesn't like to acknowledge it, but there are many gaps that they don't fill, regardless of what they tell you during the sale process. And you and I were talking about earlier, they had an app marketplace, an app market that they shut down in 2022. And it felt like they were completely freezing out the third party space, but they had probably under some pressure just reopened that in January. And there are some vendors in there that are Epic vetted vendors, right, for their own ecosystem, which could be problematic if you're talking about competitiveness. And I'll talk a little bit about my friends at Panda Health, part of Vizient. I've worked with these guys. They were created as a kind of a third-party intermediary to solve these issues. And so Vizient was working with their clients, by and large health systems, academic medical centers. Those buyers advised Vizient that they had gaps in their Epic deployments that they wanted to fill and needed help vetting the many vendors that operated those areas, some of which Epic doesn't acknowledge or didn't acknowledge. And the Panda Health model has kind of built these categories to map to those gaps. And then the vendors that they vetted have been pre-screened for technical capabilities and financial viability and security constructs and contractual standards. And Panda says they can reduce that procurement cycle by 50% or more, right? Because so many of those things I mentioned, again, you have to pick the vendor, and then you've got to figure out, like, if the vendor can actually do the things that they say they can do. And then you've got to figure out if they're financially viable. In this world, financial viability is maybe first, right? If you've got somebody, you're not going to, you get, again, I've been in projects where you're 2 years into a project and the company goes bankrupt. It's not fun, right? And how do you avoid that? Well, you can't avoid it, but you can, you can soften the impact with research.
You got to do your due diligence.
You got to do your due diligence, right? I mean, and then look at security and security questionnaires. And most health systems have, you know, or you're required to be high trust, you're required to be Mars, you're required to be FedRAMP, FSMA, and they still want to hit you with a 250 question security questionnaire, right? Because again, this is what they've got to do. These things all take time, right? You know, that just that security questionnaire alone can take orgs, even if they are high trust certified, can take them months to complete, right? And so, you know, and then contracts. Let's say you picked and you got through, and then now you're in contract, and contracts can be another year, right? So you're talking, it can be 2 to 3 years, all of the things being equal, for you know, idea to pilot even, right? Not like you said, you're only going to give you 12, maybe 18 months. I was talking to some folks, they wanted the pilot to wrap up in 6, right? And that's, again, that's the world we're in. It would be hard, right? How are you going to you can't bend the curve in 6 months, or even so. Anyway, but these are the very real challenges that are facing folks, you know, kind of in this world, right? And again, I keep bringing up Epic because Epic is everywhere, as they like to tell, right? And if you're talking about health systems, it's going to be part of the conversation. It has to be, right?
Right. Thank you so much for sharing that. And I have never seen a pilot go up in 6 months.
Impossible. Yeah. Not to do one that actually worked, right?
Yeah.
You're dooming yourself to failure, right?
Yeah. And it's not even an MVP. Yeah. Okay. Last question. What are you seeing as viable technology investments in today's healthcare climate? Are you finding that there's a common why behind the problems that the providers are seeking to solve? What are you seeing? What trends? I know you just came from Vive, so you may have learned some really interesting nuggets there.
I did. I will tell you, you know, I will say this. I'll say that technology investors, be they institutional investors or enterprise investors investing in projects, they are increasingly going to insist on the ability to draw a bright red line from their investments to value, right? Be it increased revenue, reduced costs, shortened cycle times, but there has to be a tangible, measurable example. A good example of this is I'm working in the Medicaid managed care space, right? Which, you know, traditionally has been underinvested on the technology front. You know, Medicaid is really just now being kind of realized as a viable mechanism to take care of the poor. And there's investment flowing into it and risk, and, you know, some really amazing stuff that's happening in the technology front to enable providers, enable them to take, you know, enabling PCPs to take risk and take care of Medicaid patients and make money doing it, right? Which is, it's a fabulous thing. You know, but, you know, they are investing this health plan. They're investing heavily in quality systems, meaning improving the quality of their care system-wide, right? But measuring the quality, right? Because with the health plans and quality specifically, they get paid on measures in a variety of ways, right? There's, you know, if you're a Medicaid provider and you're competing in the state exchanges, your ratings go on your listing. And so when a consumer goes to pick their plan, what your ratings are in these different areas show up, and that's all they have to compare. Those measures also, you know, if you're talking about childhood immunization, for example, that measure has, you know, getting more children immunized. There's a cascading set of provider touch points, care touch points, cost touch points. You know, there's all kinds of studies about, you know, children with all their vaccinations over the life, you know, live longer, live healthier. I mean, there's all kinds of anecdotal things that are tied to these metrics. But this is an area where if you are a vendor that's helping them do these things, it's something that they can measure how effective you are, right? And so that's what I think is yes, there are areas that are, again, with my looking through the world with a data lens like I tend to do, this, and again, those measures, HEDIS measures, ECQMs, CQMs, that's really the future of, value-based care, right? Because if you're getting away from a fee-for-service model and you're going to some kind of variabilized model where you're measuring on customer satisfaction and access and, capability, and this is, I would argue that data enables value-based care. Without good data, you can't do it, right? Mm-hmm. And so anything that, again, where you can draw that bright red line, they're going to invest in. They have to. If there's no, again, I've been involved in really cool projects in the past that you couldn't have done this with, that may have had, a more esoteric outcome or right. But those, we're not in those times right now. Everything needs to be, very pragmatic, in my humble opinion.
That's great advice, great insights. Jomo, thank you for sharing such a wealth of knowledge and perspective with me, but for our audience that will tune in, is there anything in closing that you would like to share as a parting thought or a point to wrap up on?
Yeah, no, I mean, I thought about that a little bit, and everybody always asks me, where is this going? What's the future? Prognosticate, right? And honestly, it's going to be a tough few years, right? And we didn't even talk about the gorilla in the room, artificial intelligence, right? We haven't even touched on where that fits in all of this.
There's enough people talking about it, so.
There are, and I'm not trying to, I follow it closely as well, and I don't know where it's going. But, certainly it's going to be a challenging few years on the digital health front. I will flip that around and say, I read a blog the other day that said it's the best time in 30 years to start a company, right? Oh. And they listed a bunch of really good reasons why they said it was, and they were all valid reasons. Mm-hmm. And so maybe there's cause for hope, right? But it's going to be different. It's going to be different than it has been historically, and it's going to be, But I think we'll all be better for it when we come out the other side.
Great. Well, thank you so much for being here with us today. It has been a pleasure to spend this time with you and to learn from you and hear your thoughts and perspectives. Thank you all for joining. We look forward to seeing you in our next event. Have a great day, and thank you very much.